My name is Avery Hidalgo, and I'm going to be talking about infertility for my Health Science 425 project. For those of you that don't know what infertility is, it's not being able to get pregnant after 1 year of trying or 6 months if a woman is 35 or older. Couples are not naturally able to conceive a baby through unprotected sex, and infertility takes place in both females and males. Infertility in males has multiple causes, such as low sperm count, where the male just ejaculates a low number of sperm, low sperm mobility, which is the sperm not able to swim properly or as well as it should to reach the egg. There's also abnormal sperm. The sperm has an unusual shape, which makes it harder to move and fertilize the egg. If the sperm does not have the right shape or cannot travel rapidly enough, then it makes conception difficult because it doesn't reach the egg, and up to 2% of men are thought to have suboptimal sperm. For infertility in females, the common problems are with ovulation, because without ovulation, there's no eggs to be fertilized. Two common problems is polycystic ovarian syndrome, which is a hormone imbalance, and that's the most common cause of female infertility. The next is primary ovarian insufficiency, which is where the ovaries stop working normally before she is 40, and this is not the same as menopause, which a lot of people mix up. There are less common causes of fertility problems in women, such as blocked fallopian tubes, due to pelvic inflammatory diseases, endometriosis, or surgery from an ectopic pregnancy. There is physical problems with the uterus, or there's uterine fibroids, which are non-cancerous clumps of tissue and muscles on the wall of the uterus, which makes it hard to conceive a baby. Now, there's steps to diagnose male and female infertility. For males, it's general physical examination and medical history to see if it runs in your family. There's semen analysis to see if the sperm is low mobility or just low count. There's also other tests that can be recommended for males to see as to why he may be infertile, such as scrotal ultrasounds, hormone testing, post-ejaculation urine analysis, genetic testing, and testicular biopsy. For females, it's basically a lot of imaging tests done, such as ovulation testing, ovarian reserve testing, image test, and then the hysterosalpingography test. They may recommend a laparoscopy or genetic testing or other image testing done to see as why someone may be infertile. There is treatment for males, such as surgery, because some things within their penis is going to be able to be reversed or repaired. You can treat infections if that's the cause, such as antibiotics, to cure reproductive tract infection. There's treatments for sexual intercourse problems, such as meditation or counseling if your sexual drive's low, hormone treatments and medications, and then there's ART, which is the assisted reproductive technology, where the male normally ejaculates, but then a tool is used to insert the sperm into the female genital tract to make sure it travels farther, and doctors tend to suggest looking for a sperm donor if none of these treatments exist or work. For females, there is mainly therapy often recommended. Sometimes you need 1 or 2 therapies to restore fertility, or sometimes you need multiple different types of treatments, such as medication or surgery. There are fertility drugs that you can use that have been mentioned, and then there's surgical restoration, like the laparoscopic or hysteroscopic surgeries, and then the reproductive assistance type surgeries, such as the ART one or the intrauterine insemination. Now, what would increase the risk of fertility for females and males? They have a lot of common ones. For females, it's age, smoking, excessive alcohol use, extreme gain or loss of weight, extreme physical or emotional stress. Males, it's age, obesity or overweight, smoking, excessive alcohol abuse, exposure to radiation, exposure to high temperatures to the testes, high toxin environments, and exposures to certain kinds of medication. For stats on fertility, about 6% of married women aged 15 to 44 years in the United States are unable to get pregnant after 1 year trying, which is the definition of infertility. Now, 12% of those women that in the United States of the same age group have trouble getting pregnant or carrying a pregnancy to term, regardless of marital status. 35% of the couples with infertility, a male factor is identified along with a female factor. In 8% of those, it's just a male factor that is the cause for infertility. And almost 9% of men aged from 25 to 44 in the United States report that their partner saw a doctor for advice, testing, or treatment for infertility during their time. This is crazy to think that this many people struggle with this, which is why it's important to find ways to help them. Next is going to be my references. I have used Mayo Clinic as well as CDC. Thank you. I hope you realize the importance of finding help for infertility people.